Thank you so much.
Thanks, Dr. Amandeep. Thanks for your nice introduction on me. Um, all of you, can you see my slides? Can you see my slides?
Yes, sir.
Dr. Amandeep.
Yes, sir.
Good morning to all of you. Once again, thanks to Dr. Amandeep. Thanks for inviting me this international webinar session. Thank to the ISF College of Pharmacy Management and directors and all the participants and my dear students. So today is a topic is disaster preparedness for medication users. So what is disaster management or disaster preparedness? So as we are the health professionals, we should know what is a disaster. For the emergency is a natural disaster conditions. How we have to manage the drugs. How we helping the people. These are the very very crucial and role of clinical pharmacist. With that, there are different types of natural disasters. It's like tsunami, landslides, and flood, and overheat. It's excess hot climates, and thunder, and tornadoes. There are different types of it's a natural disasters. With these conditions, what is the role of a clinical pharmacist? Is very important. No, we play an important role during the natural disasters. So before natural disasters, let's say in India, we have identified some of the regions or some of the places is a high prevalence of natural disasters. So based on the locations or a place, we must keep some the emergency medications and the emergency care units to rescue the people if any emergency, how we take care of the people. Also, especially what medications we have to manage with the condition of natural disasters. Okay, we have to make a plan. So based on the disasters, we have to make a plan and ready for the 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 kits, the drugs, ready for the drugs. And also we are labeling of which drugs is suitable or which drugs is as a emergency or normal medications. These all we have to keep in the record as well as in the storeroom. So as an emergency plan, we must have a plan which medications we are storing, how we are storing the medications, what type of medications we are storing in the refrigerators or normal conditions. So these all we have to prepare, especially the 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 location aspects, like the natural disasters. Before natural disasters, we have to keep ready for all the medications. Especially we identified these are the areas are highly high chance to attack the natural disasters. So these areas are nearby. We need to keep some emergency medication kits. Also we need to have some emergency units which composed pharmacy, emergency treatment care units, and other laboratory facilities. Before natural disasters, we need to maintain all the emergency drugs, including emergency drugs, insulins, some emergency antibiotics. So these all we need to keep with the proper store and the storing in the refrigerators. Let's say some antibiotics we need to keep is with the condition of the refrigerators, as well as some drugs we need to keep. Some insulin is an emergency, we need to keep the refrigerators. During natural disasters, sometimes no power, no electricity. So that time we need to have some uh, you know um, the the manual refrigerator kit, the manual refrigerator boxes to keep the medicines. So these all, as an emergency or a clinical pharmacist, we have to make sure all the medications in place or not. So these all our responsibilities. After the natural disasters, immediately we seek the patient attention. Those who are needed for the medications, those who are needed for the medical emergency attentions. As per the drug evaluations and the research centers, they have given the guidelines. So, what are the guidelines? What instructions we should follow during and after disaster conditions. They offer like how to use the medications in the flood conditions and the landslide and high temperature conditions, how we need to storing the medications. These all we have to know. Let's say, many countries, they're affecting from natural disaster. Recently, this month, Libya affected flood. So the emergency is, we cannot predict, but we may know. So what are the area or regions maybe will affect by the natural disasters. So based on the area of natural disasters, it means prevalence of the locations nearby. The government also has to take the initiative. Apart from the government, then the NGOs and social welfare organizations also will take the part of the caring of the people. So after natural disasters, there are many ways, to spoil the drugs. Sometimes, excessive heat is one of the factors. It may affect the drug nature or drug efficacy. So if due to the heat, if damage of the drug efficacy, immediately we have to replace the new medications, because the old medications may not suitable for the patients to give the therapeutic response. The same, the flood conditions also. If severe flood conditions, sometimes our medications may be contaminated from the wastewater, or sometimes uh, spoiled by the flood conditions. So these conditions, we need to keep safe the packaging materials to avoid the contaminations. If suppose the drugs contaminated by water, we have to immediately discard the medications. Otherwise, it may lead some serious or unwanted toxic effects. So these all we have to make sure as a clinical pharmacist. Also, the health educators have to educate the students in the flood conditions or any emergency or natural disasters, how we need to maintain the drugs, or what are the precautions we have to follow, which is very important. How to follow the clinical pharmacists in their practice. Okay, life-saving drugs, which are very important. Some of the drugs we classified into, there are different classes of drugs. Based on the disease conditions, we are prescribing the medications to the patients. At the same time, we need to list out the emergency or life-saving drugs, and apart from the life-saving drugs, there are other drugs also. The life-saving drugs are very important, especially the condition of natural disasters. So these drugs we have to make sure how much drugs available, and how we are maintaining the drugs with the proper store conditions, storing the proper storage. So these all our responsibilities. Okay, during and after the natural disasters, how we are maintaining especially the vials, and some injections, because the injections are easily contaminated by the environment. So how we are going to maintain these all precautions we have to follow, even though the water for injections, when we dissolve the drugs into the vials also is, which is very important. Otherwise, if contaminated water if we are using, sometimes it may
Excuse me, Dr. Subramaniam ji, slide is not changing, I think.
really.
Yeah.
Can you see now? Can you see the slides now?
Yes, sir.
Now I'm in slide number 9. Am I right?
Yes, sir. Ninth.
Okay, I'll move on to the next slide. Okay, so why we need to have the refrigerations, some drugs, especially the some antibiotics and insulin drugs, because these drugs easily contaminate, the microbial contaminations. After the contaminations, if you administer to the patients, sometimes it may cause harmful or toxic effects. So that we have to make sure um, whether our drugs are efficacy is maintaining until the expiry period of all the drugs. So these all we have to maintain in the inventory management, and also in the record in the system, as well as in the hand notes. Let's say the drugs needed for, why needed for the refrigeration, just now I explained. Insulin easily contaminate. So if not refrigerated, the lifetime also, the insulin lifetime also, the efficacy also reduced. So these all negative impacts if you are not maintaining the proper storage. Also the healthcare providers, so including medical doctors, clinical pharmacists, and lab technicians and nurses, all healthcare providers. But our role is very important. The pharmacist role is very important in the healthcare team. How our role is very important. We are the one maintaining of all the drugs. We are maintaining of all the drugs, as well as the drug efficacy and compounding and preparation of the drugs. We are the main people we are involving in the preparations. So if we do something wrong, it may indirectly affect the patients. So this one we have to take more attention when we compounding of the drugs, or when we labeling of any drugs. We have to make sure whether our labeling is properly be made or not. This one we have to make sure with other partners or other colleagues. And order screening, the clinical duties, during the clinical duties or clinical management of the patients, we have to see the patient drug monitoring. Some of the drugs are allergies, some drugs are, it may cause drug interactions. So these also we have to make sure by the clinical pharmacies. So whether our drug is produce the therapeutic response, or is there any disadvantages. So some drugs we should monitor the therapeutic monitoring. Some drugs, the normal drugs, no need to go for therapeutic drug monitoring. Example of paracetamol or any other regular medications, no need to go for therapeutic drug monitoring. But some antibiotics, we need to have therapeutic monitoring. And also the selection of medications, which is very important. Based on the condition of the patients, we have to make sure we have to select the medications. If unless inappropriate selection of medications, it may chance to develop the resistance. Finally, there is no response, or sometimes it may produce toxic response. So these all negative impacts if we are not follow the proper procedures. So the appropriate of medication administration, which is very important, especially the clinical pharmacist. So during the resuscitations and trauma conditions, the emergency pharmacist at the bedside overseeing the medication use process. It means that during the treatment emergency conditions, in the emergency room or emergency surgical operation theaters, the emergency pharmacist should be in the room, because the emergency pharmacist has to follow the medication process and the procedures, how they're using the medications. If they're inappropriately using the medications, the emergency pharmacist have to correct them, how to use the medications, or what is the dose, how frequent they're using the medications. These all our important responsibilities. And availability and accessibility and visibilities, this is very important. So when you prescribe any medications, we have to monitor the drug administrations. We have to monitor the patient experience or pharmacological response from the patients. Also, we have to report the patient conditions. So when we go for any emergency conditions, physically we need to present in the emergency room, and also we have to make sure whether appropriately they follow the medications or not. Already we I explained, so what are the different conditions of the disasters. Natural disasters are different types, like due to tsunami, different types of tsunami, high wind, tornadoes, like flood is a severe flood conditions due to rain, or some other reasons. And also landslide is one of the major threat. So there are different types of natural disasters, but as a clinical pharmacist our role is very important. The situation of natural disasters, what are the responsibilities? Patient education is very very important during the natural disaster or after natural disasters. As a clinical pharmacist, you have to educate the patients. So don't worry, so we have enough treatment facilities, so we will save your life. So we have to give the counseling to the patients, because mentally they are upset. Mentally they all upset, or sometimes mental depressions. So we have to educate the patients how to save the patient life, or how to give boost up the patients, how to motivate the patients to come to the normal life. And also nursing educations, we have to take care of the nursing educations, which is very important, caring of the patients. And provider educations, so education also important. Apart from the treatment, we have to educate the patients, we have to educate the young students also. So what are our responsibilities? Everyone have important roles: pharmacists, nurses, medical doctors, technicians, all the healthcare providers having their own responsibilities during the natural disasters. And patient education, what is patient education? This is a very important process. While with the condition of natural disasters, the patient definitely is very upset. Sometimes they lost their family members and their belongings. So at the time we have to give our our motivations. Maybe our mental health is very important. We have to give mental health awareness, or we have to give some positive messages to the patients to come out from the depressions. So these all our responsibilities as a healthcare providers. And also conduct and continuing education sessions. Apart from the patient part, in the educational institutions, we have to teach our students what are our responsibilities. Some of the students, they know only our responsibilities. Okay, after completion of bachelor degrees or master degrees, they're going to practice in hospitals, or maybe they're going to practice in the laboratories, or maybe they're going to practice in the educational institutions. Not only our area is not narrow of responsibilities. We have a broad responsibilities, including of clinical research and natural disasters. What are our responsibilities? And socially, what is our role? How we educate the people. So these all the pharmacists have is a lot of responsibilities. Apart from uh, uh, apart from the known responsibilities, we have other responsibilities also. We have to educate the society. What is drug interactions? Why we need to take antibiotics? In India and other Asian countries, antibiotic resistance is a high prevalence. It's one of the global threat also. Why antimicrobial resistance occurs? Mainly due to inappropriate use of antibiotics. Because sometimes without proper diagnosis, we go for antimicrobial treatments, which is very dangerous for the patients. Based on the clinical conditions only, we have to select the antibiotics. If anybody suffering mild pain or mild body temperature, mild increasing of body temperature, we immediately should not take any antibiotics. It's very dangerous. Based on the clinical conditions or diagnosis, then only we go for based on the infections. Antibiotics mainly we are giving for infections, not for reduce the body temperature, not for reduce the uh, inflammations. These drugs only for infections. So when get infection, body get infections based on the proper diagnosis or which microorganisms involved. So based on the microorganisms only, we have to select the antimicrobial agents or antibiotics. But if without proper diagnosis, if we select or if we administer the antibiotics to the patients, it may chance to develop the high risk or resistance. So these all we have to make sure and our responsibilities. And also up to date knowledge. There are newer drugs, newer antibiotics, new drugs also available in the market. So we need to update. We need to up to date our what type of drugs available in the market, what is the mechanism of the drugs, what are the drug interactions. When we allow one drug, sometimes the another drugs, it may chance to develop the interactions. So we should not give certain drugs, we should not combine certain drugs, we should not give combination therapy, because drug interactions. If drug interaction, sometimes it may develop the toxicity, sometimes there is no pharmacological effects, there is no therapeutic effects. So there are many things we have to understand. As a clinical pharmacist, we have to understand all the importance of how to use the medications, not only for emergency, even though the normal conditions, when we prescribe the medications, we have to follow all the instructions, and guidelines based on the drug prescription guidelines, and assist research for improving the patient safety and emergency medications. As a emergency pharmacist, also should involve research. So, how to improve the patient quality of life during the medications? It means during the treatment times. So, these all we need to have some interactions, some workshop, some research initiatives. Then only we'll get some impacts. How to improve the prescription practice, and also the benefits of teamwork is which is very important. So we have to have some good team, including medical doctors and nurses, and young graduates, even though the students also we can involve. um, how to improve the quality of patient life, how to improve the patient prescription, how to improve the patient, how to improve the drug administrations. So there are different types of discussions are very important to improve the prescription, to improve the medication prescriptions. Also the practice is which is very important. uh, Improve the prescription, improve the patient prescription means improve the practice of the medication prescriptions. Also we need to, when we improve the quality of prescriptions, automatically reduce the adverse effects or adverse events, so which is very important. So in one person or one healthcare providers cannot do everything. So when we have interactions, their experience also they are sharing, our experience also we are sharing. When we are sharing of our practice experiences, then we'll make sure the quality of prescriptions. So these are the references. um, okay. These are the references. Thank you all. Thank you very much.
Thank you very much, sir, for your wonderful talk in very precise manner. So, sir, there are some questions from the students. Yes, please, you may ask. Yes, Dheeraj. I think Neeraj Patil is there. Yes, please ask.
Okay. The first
So I
question
think-
is, okay, have we considered how we will transport and store our medication in the event evacuation of? Very good question. Thank you, Neeraj Patel. You know, during emergency conditions, we are using nowadays drones. You know, we can the transport also cannot go because the road affected by natural disasters. So when we use the drones, you know, the drones nowadays is easily, you know, carry the medications up to 3 kg, is a 10 kilometers or 15 kilometers. In India also they are using different types of drones, so we can use the drones. Thank you very much for your valuable questions.
Yes, dear.
Are you understand, Neeraj Patel?
Sir, I think he has again raised a question. Yes, please,
No,
Neeraj.
Okay, please. Next one. I'm happy to answer your questions. Please proceed.
Yes, please drop in the comment. No issue.
Any other?
Yes, dear. Any other? So, sir, I think, sir, he has again joined. Yes, Neeraj, any other question, dear?
Okay, it's okay. No, fine. So any other doubts or any other questions? Do you have any other questions? No.
Sir, what happened in case of vaccines and other formulations also?
Repeat again, sir.
Sir, what happened in case of vaccines and other formulation also?
Definitely. Vaccines also we must keep, in the refrigerations only. If vaccines we are not maintaining in the proper refrigerations, definitely will spoil. It means contaminate. Thank
Sir,
you.
I think there is a question from Animesh. Yes, dear.
I think Animesh, something is raising hand. Fine. I hope you all understand, what is emergency, what is natural disasters, what are our responsibilities. Am I right? Okay. Have we considered how we'll manage chronic conditions or maintain proper medications and adherence? Okay, adherence in the case of the extended disaster situations is a very good question. Definitely, we have to make sure the proper planning of storing of the medications. We have to categorize, emergency drugs and non-emergency drugs. The emergency drugs such as, insulin, and cancer drugs, and daily using of diabetic drugs and hypertension drugs. These all, every day they should take, the patient should take these drugs are, which is mandatory for the patient. So these drugs definitely they have to keep with the proper refrigerations. If no electricity or other issue on the power, so we have to make sure the manual kits, the manual refrigeration kit. So this one we can easily manage by the different transportation. Also we can manage transportations. Maybe we can use like a small drones. These are mobile phones, like some communications through some electric communications. Definitely we can manage this, but the proper plan is very important. So how to identify? Okay, I don't know when it will come the natural disasters, but we know, these are the areas are highly chance to get the natural disasters. In India also some areas are there identified, so from some natural disasters. So based on that, the government, state governments, and social welfare organizations, definitely they have some precautions. it means they have some preparedness. Thank you.
Thank you so much, sir. Yes,
Thank
dear,
you.
anybody
Thank
have
you,
any
Dr.
query?
Amandeep.
So thank you so much, Vetri sir.
Thank
Sir,
you, everyone.
definitely,
Thanks to everyone.
future, sir, there might be possibility of any collaboration with you in the form of research and
Definitely.
something else, sir.
You are most
Definitely,
welcome.
sir.
I'm very happy to collaborate with you and your college. Thank you very much for inviting me
Okay,
once
sir.
again.
Thank you so much, sir. Thanks to
everyone.
dear students for your kind patience and for your noble questions, which might be understandable more. Definitely, it will put some values in your life also, in your daily life, in the pharmacy pattern also. So thank you so much again, sir.
Thank you very much. Thanks.
Have
Once
a nice
again,
day.
thanks to everyone.
Goodbye,
Nice
sir.
to-
Have a nice day. Bye-bye.
Bye. Bye.